Hello, my name is Dr. Gordon Ambayo. I'm a psychiatrist. Welcome to my video on understanding depression. Thank you for listening to my previous videos. This video is meant for non-medical people, so I will use very few technical terms. Now, before I start, I just want to say a story, one of my experiences with one of my patients. One day I asked one of my patients, who is a psychiatrist? And he told me a psychiatrist is somebody who is ready to listen to you as long as what you are saying doesn't make sense. But before we talk about depression, we need to know what is the normal mental health. The World Health Organization defines normal mental health as a state of well-being in which every individual realizes their own potential, can cope with normal life stresses, and can work productively, fruitfully, and able to make a contribution to the community. So when you have depression, these activities are impeded. You may not be productive. Now, depression is defined as a mood disorder in which there's persistent feeling of sadness and loss of interest in activities and causing significant impairment in daily life. However, we need to have some other more signs and symptoms, which I'll discuss later, for you to qualify for a diagnosis of major depressive disorder. Now, when depression causes illness, it is called major depressive disorder or clinical depression. Now, major depression affects how we feel, think, behave, and can lead to a variety of emotional and physical problems. Now, depression is a cluster of symptoms and is affected by derangement in neurochemicals in the brain known as neurotransmitters. Depression is also a leading cause of suicide worldwide. Now, how long does untreated depression last? For those who do not go for treatment, untreated depression will last for about 6 to 24 months and then remit naturally, and this may recur later on. Now, depression is a common illness worldwide, and estimated about 3.8% of population are affected by depression during their lives, and this includes about 5% of adults and 5.7% of people older than 60 years. Depression is more prevalent at the age of above 60 years because these individuals have lost certain abilities they used to have, which lead them into depression. And some of them are also lonely because their children and grandchildren do not bother to take care of them and even visit them. Now, approximately 280 million people worldwide have depression, so it's not a small figure. Now, there's a friend of mine who is a pastor. I was walking in the village and I found when he was looking very sad, I asked him, "Pastor, what is the problem?" He told me he had lost his bicycle. So I asked him, "Where did you lose your bicycle?" He told me, "Just within the village." So I told him, "What you do? Next Sunday when you are preaching, preach about the 10 Commandments. And the person who stole your bicycle may be in the congregation, and you'll feel guilty and return the bicycle." So after 2 weeks, I went to church, and after the service, I asked the pastor, "Did you get your bicycle?" He said, "Yes." Then I asked him, "Did you preach about the 10 Commandments?" Because I had missed the previous service. He told me, "Yes." Then, "Did the person who stole your bicycle bring it?" He told me, "No." As I was preaching about the 10 Commandments, When I reached, do not commit adultery, I remembered where I had left my bicycle. So I went for it after the service. So that is how the story was. Now, in 2017, World Health Organization ranked Kenya as the 6th African country with the highest level of depression. And the figure was estimated to be 1.9 million Kenyans suffering from depression. And majority of them had not sought treatment. Now, worldwide, depression leads to suicide, and WHO estimates that 800,000 people commit suicide annually. And majority of those who commit suicide are between the ages of 15 to 29. And in this age group, in most countries, the suicide amongst those between 15 to 29 is the second leading cause of death. Now in Kenya, WHO, which is World Health Organization, estimates that 1,408 people commit suicide annually. This translates to about 4 deaths daily. Now, what are the different types of depression? We have different types of depression. In children, we have disruptive mood dysregulation disorder. That is the depression which is most common amongst the children. And in children, the prominent feature in depressed children is irritability. When you see a child is easily irritable, then you need to, a child who was very happy before and now is irritable for more than 2 weeks, then you need to take this child to a psychiatrist. Now, we also have major depressive disorder, which is occurs in adults. Then we have persistent depressive disorder. This is a depression which may not meet all the 5 criteria required for a diagnosis of major depression. So it's a mild form of depression, and this is known as dysthymia. Now, these people who suffer from persistent depressive disorder, they don't smile from January to December. And even when you make a joke, when you're with them, they will not smile. So if you have such a person around you, take this person for treatment so that they are treated for persistent depressive disorder. Then we have premenstrual dysphoric disorder. This one occurs before ladies have their monthly menstruation, and the women affected normally feel sad, easily irritable, and sometimes this, if it is persistent and not treated, can lead to strained relationship with a boyfriend or the spouse, and even sometimes divorce. So such ladies need medication. Then we have also substance-induced depressive disorder. Substances like alcohol can cause depression. Those who have taken alcohol in large quantities for a long time can develop depression. So this also need to be treated. Now, we also have depressive disorders due to other medical conditions. Some patients with chronic illnesses like diabetes and cancer can easily go into depression because these are long-term illnesses that can lead to depression. Now, we also have atypical depression. Atypical depression is a subtype of a major depressive disorder. These patients don't lose weight, they don't lose appetite like other depressed patients, but they have increased appetite or weight gain. And they also sleep a lot. They sleep excessively, longer hours, and they also have a lot of fatigue and weakness. And they have moods that are easily reactive to environmental circumstances. This is called atypical depression and is more common in those who have had trauma in their lives. Either they have encountered life-threatening accidents, or they have undergone major surgery like removal of brain tumor. These patients will have what is known as a typical depression. Are there other types of mood disorders? Yes, not all mood disorders are depression. We have other mood disorders known as bipolar disorder. We have bipolar 1 and bipolar 2. And then we have cyclothymia. It's also a mild form of bipolar disorder. Now, we also have seasonal affective disorder. Seasonal affective disorder occurs in northern and southern hemispheres, where sometimes the night is very long for a long period of time. And during those seasons when they have the long nights, some people go into depression. Now, what are the risk factors of depression? Or what are the predisposing factors? These are medical illnesses, as we have mentioned, long and chronic medical illnesses like cancer and diabetes. Chronic and daily stress at work can also lead to depression. There are several times I've had to write letters to human resource managers for the employees I'm treating who need reduction of their workload so that they can recover from depression. Then chronic pain. Those who have chronic pain like in rheumatoid arthritis, these pains can be very distressing, and these patients easily go into depression. Again, if you have a family history of depression, then your chances of getting depression is very high. Being a female predisposes one more to depression than being a male. In fact, statistics show that the ratio of male to female in depression is 2:1. Then low-income jobs can also, or lack of finance, can lead to depression. Low self-esteem. A lot of people have low self-esteem, so they can easily go into depression. And low social support. If somebody has problems and is not getting support from the family, then they can go into depression. Now, we also have certain conditions which occurs in old age, like dementia, where these old people with dementia can also have depression. There was a time I was living with an old man, and he was 95 years old. I'd invited them to visit me for some time. He also had a wife who was 85 years old. And every time he used to call his wife, darling, darling. So I asked him, Mzee, at 95 you still call your wife darling? Then he told me, yes, I call her darling because I forgot her name 10 years ago. Now, other risk factors for depression are prior depression. Somebody who has had depression before is having a higher risk of having another episode of depression. Then you have single or divorced people have a higher rate of depression than married people. Then, as I had mentioned earlier on, traumatic events and traumatic brain injury and brain surgery can also predispose one to depression. Now, when we come to causes, we have biological factors, we have family history and genetics, which can lead to depression. So some depression is inherited. Other causes of depression are neurotransmitters. In most cases, these neurotransmitters are reduced in the brains of those who have depression. Neurotransmitters are chemicals found in the brain that helps the brain nerve cells to communicate from one cell to the other. And these neurotransmitters, the most common ones implicated in depression are serotonin, dopamine, norepinephrine, and histamine. Now, when these are reduced, then the patients get depression. So the drugs we use in depression work by increasing the levels of these neurotransmitters. Now we have also hormones. We also call them neuroendocrine. Certain hormones, if you have hormonal disorders, can also cause depression, like conditions which we call Cushing syndrome. Now, the immune system can also contribute to depression. When our immunity is reduced, then we also tend to be depressed. Now, sleep problems. If you don't sleep well, or you sleep and wake up most of the night, then you are more prone to depression. Now, we also have psychological causes, things like stressful life events. If you, for example, you are in a toxic relationship where there's a lot of quarreling and domestic violence, then you are likely to get depression. Now, we also have personality factors. Those who are negative emotionally are likely to have depression. Then some of the medications we use to treat patients, like some drugs used for treating high blood pressure, like Aldomet. Some of them we call beta blockers, which are like Inderol, propranolol, tenomine, atenolol. This can cause depression. So as doctors, when we put patients on this medication, we have to be on the lookout for depression. Alcohol, consumption of alcohol and other drugs can also cause depression. What are the most common symptoms of depression? The most common symptoms are the persistent depressed mood. For you to be diagnosed with depression, you must have a persistent depressed mood for at least a minimum of 2 weeks. Then there's also loss of interest in the things we used to enjoy, like hobbies like watching football. Then sometimes loss of interest in the things we used to love. This can even include loss of interest in our spouses. Now, feeling of worthlessness. Some people feel they are worthless. Then some people develop poor concentration. You go to the office, you start working, and you find after 15 minutes you cannot continue because of lack of concentration. Then some people think of harming themselves. Suicidal thoughts are some of the common symptoms, signs and symptoms of depression. Other signs and symptoms of depression, previously I was talking about the most common ones, but we also have other signs or symptoms of depression. I'll go through them, including the ones I've discussed. So the signs and symptoms of depression, number one is feeling sad or empty. These patients have mood changes and they feel sad or empty for at least a minimum of 2 weeks for them to be diagnosed with depression. Feeling of hopelessness also occurs in these people. Then the third one is feeling of worthlessness. Now the fourth one is feeling excessively guilty. Some people may have lost a loved one and then they start feeling guilty that maybe there's something they failed to do that if they would have done may have saved the patient or the relative from dying. So this guilt feeling goes for a long time until the patient develops other signs of depression and they are diagnosed with the depression. The fifth sign of depression is lack of interest or pleasure in activities. Some people with depression lose interest in the things they used to enjoy, like sports, going out with friends, music, and even sexual activity. Now they may turn down offers or opportunities to do activities with others, so they end up not enjoying what they used to do. There is anger and easy irritability. A person with depression may seem to be angry with others. They become easily annoyed or irritated, and men are more likely than women to be angry or irritated. Anger and irritability is an important sign of depression in children. So if you have a child who is easily irritable, then you need to take this child for treatment. Children may not express their depression the way adults do. So they'll do this through easy irritability. Now, feeling of tiredness and loss of energy. Some patients feel they have no energy to do their day-to-day activities, or when they start doing those activities, they become tired very easily. So this is the seventh sign of depression, and very important one. Now, the eighth sign is a lack of sleep. So some patients, majority of patients with depression normally present with a lack of sleep or poor quality sleep, or they go to sleep very little, and then toss around in the bed until morning. Now, loss of appetite is the 10th sign of depression, and people with depression lose their desire and appetite for food. They may also lose weight because they're not eating enough. Again, 11th sign, opposite of the 9th sign, is overeating and weight gain, which I said earlier on occur in people who have experienced trauma, and is known as occurs in a typical depression. Now, 13th sign is a thought of death or suicide or self-harm. Some people with depression develop these feelings. Some of them go to the extent of implementing their suicidal thoughts, and they only found dead. So we need to be on the lookout for these people who have signs and symptoms of depression before they reach the stage where they commit suicide. Now, what is the treatment of depression? There are medications we normally provide for these patients, which act by increasing the neurotransmitters in the brain. So the depressive symptoms wear off with time. So before we put these patients on treatment, they need to meet at least 5 signs and symptoms of depression, minimum 5 signs and symptoms of depression before they qualify for treatment. Those who meet less may recover through psychotherapy and counseling. Now, we normally, even in major depression, we combine medication with the psychotherapy so that the patient's issues are tackled by the psychologist. Now, when treatment starts, it takes long for the effects of the drug to work. It takes about 4 to 8 weeks for the patients to see the effect of the medication. So patients need to know this so that they don't throw their drugs away after 1 week or so. This is not like other diseases like pneumonia, malaria, where recovery takes place within a week. So after 4 to 8 weeks, the patient will feel the symptoms have subsided. We call it remission, but the patient has to continue with medication for at least 6 months, minimum 6 months after remission of symptoms. If they stop taking medication before these 6 months, the depression will recur. Now, it's also important to follow the doctor's instructions on the appointments. Go for your appointments. Most of them are normally monthly appointments. And even stopping these medications, they're supposed to be stopped over a period of time during which the dose is reduced. And this will be done by your doctor. Don't stop medication on your own, because you'll have what are known as withdrawal symptoms that can sometimes be very severe and even lead to the patients being admitted. What is the outcome of these patients we treat with depression? 80% will recover but the remaining 10 to 20% will become chronic and will require chronic medication and other more advanced treatment, which will be prescribed by your doctor. Another percentage end up committing suicide, as we had mentioned. So we really need to ensure that we look keenly after these patients. The patients also need social support. They need support from the relatives or the people they're staying with, so that they are provided with a good environment at home for recovery. Normally, we establish a relationship between the doctor, the patient, and the relatives. This is called a therapeutic alliance. So we work along the treatment time with these patients and their relatives. So, is there prevention? Prevention includes education programs so that people do not expose themselves to factors that lead to depression. For those who are working, you need to take off, you need to take leave, don't overwork yourself. And you also need to go out during the weekends. There are times you should even switch off your phone and be away from social media. Sometimes the news we get or information we get from social media can be depressing. Again, exercise programs. People must have well-defined exercise programs, not impromptu exercises. You must have a daily routine, and you must have a record of the exercise you are doing daily, so that you know you achieve your targets. A lot of our phones nowadays have apps which can help you in your daily exercises, and those apps even record what you have achieved on daily basis and even weekly basis. We should also eat a balanced diet. Balanced diet means you have fruits, vegetables, carbohydrates, proteins in your diet, so that you be a healthy person. The other thing is connect with friends and relatives. Don't live in isolation. Ring your friends and relatives occasionally, so that you can chat and also know what the problems they have, and also share your problems with your friends and relatives. So, thank you very much for listening. You are welcome to subscribe to my channel, YouTube channel. So, feel free to watch my upcoming videos.